This program is brought to you by Bid Select, the Neely School of Business at TCU, Community Trust Bank, and Medical City. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Welcome back, everybody, to Platforms, the life-lifting news program for women. We're wrapping up our conversation here this afternoon with Dr. Janardhan. He is the director of the Texas Stroke Institute at Medical City, Dallas. Doctor, it's been a fascinating conversation, and what I was thinking about in this last segment is we keep talking about brain attack, but you actually access the brain by going through the leg, which is kind of counterintuitive. So tell us about that.
That's a really interesting question, and the answer is, the way I look at it is, in the past, in the 70s and 80s, early 80s, they used to go in through the neck blood vessel. And one of the things that they found out was that when there are complications or bleeding in the access site, it's much easier if it were in the groin, both from a cosmetic as well as from an ability to handle it, rather than trying to occlude an artery going to the brain in the neck. And so the whole field moved away towards the leg blood vessels, and it's just like an expressway system, because once you know which exit to get in and which exit to get out, it doesn't really matter where you start, and it really takes us less than a minute to get into the brain blood vessels from the groin. So it truly is a way in which we have changed this, and now just like we have the GPS tracking system in our cars, we have 3D road mapping with RoadMap Pro, which is one of the state-of-the-art navigation systems, which we have here at the Texas Stroke Institute in our facilities, both at the Medical City Dallas Hospital, as well as the Medical Center Plano, as well as in Plaza Medical Center, our 3 hubs. And we are able to navigate to the brain blood vessels using sort of like a GPS navigation system in your car. And so it really has been a tremendous advance in technology to be able to have right now compared to what we had a decade ago.
And that's part of the integrated therapy for a patient, this 3D mapping system. Take us through that. What is the purpose of all the CAT scans and everything as part of the overall treatment?
So the way we are able to visualize the brain, since we don't go into the brain, there's no incision or any suture, we have these 2 cameras that are called a biplane neurointerventional suite, wherein we can actually look at the brain from the front angle as well as the side angle. In addition, we're able to look at the brain from a 3-dimensional angle in all directions, and we can actually use this navigation system, which, as you know, would be a wonderful opportunity to navigate the tortuous vessels. In addition, we can do a CAT scan while we're doing the procedure to understand if this brain attack is expanding, if there's bleeding inside the brain while we have the patient on the table while we're operating, so we don't actually have to take the patient to another place to do the CAT scan. And I think that's a huge, tremendous advance in technology that we are proud to have in our region here, right here in the DFW Metroplex.
Right. Speaking of, I'm just interested in the field of medicine. Why, you're obviously very passionate about what you do. Why this particular field? Why did you select this to make this your specialization?
When I was in medical school, I wanted to work on a disease that affected the most number of people in an organ that was least understood. And everybody veered away from the brain thinking it was too complex. And so I was left with 3 diseases: cancer, heart attacks, and brain attacks. And brain attacks dealt with the brain. So it kind of was able to dedicate my career to one of the 3 largest killers in the United States in an organ that is least understood. And I also lost 3 grandparents to brain attacks, so this is a personal fight for me.
Wow. Are you constantly amazed at the ability of the brain to heal itself even though it sustains trauma? And it is a remarkable organ, isn't it?
Absolutely. There's a lot of plasticity within the brain, and people recover from brain attacks differently based on how plastic their brain is to adapt to new events. And in the future, we may have therapies to regenerate dead brain cells, like using the patient's own cells to be able to regenerate their brain cells. And so there's a lot of good devices and therapies that are coming in the pipeline. And I think one of the key things is for us to be able to reach out to the community and expand these therapies to be able to achieve the care that we need, because existing therapies that we had talked about are not reaching out to as many people as we would want them to.
Very small percentage of the population, is that true?
Absolutely. If you look at IVTPA, which is the Drainx that I talked to you about, that's injected intravenously, only around 3 to 4% of the population with strokes actually get to the hospital fast enough within 3 hours to be able to get this therapy. With catheter-based therapies that as I've mentioned to you, we can treat up to 6 hours, 8 hours, and now with advanced imaging studies, possibly up to 12 hours after a stroke, which basically expands the area within which a patient can come to a stroke center to even a 200-mile radius, which is a huge help for us to be able to reach out to the community. Out here in the DFW Metroplex, the HCA North Texas division has 11 hospitals spread across the HCA hospital system within the Metroplex. And our goal is that we have unified all these 11 hospitals across all the counties into one seamless institute, the Texas Stroke Institute. And we have at each of our sites in each of our counties, we're developing a catheter-based hub, which is the Texas Stroke Institute in Medical City, Dallas in Dallas County, the Texas Stroke Institute at the Medical Center Plano in Collin County, and Plaza Medical Center as part of the Texas Stroke Institute in Tarrant County, along with the rest of the institutions within HCA North Texas division to create a stroke network rather than just one hospital trying to fight this disease. And together over a 18 to 24 month period, we want to make this a seamless system of care so that it doesn't matter where the patient comes in, we will be able to handle them. And we're also using cutting-edge technologies, namely telemedicine, which is using robots to connect to ERs in all these institutions to be able to reach out to our patients instantaneously via the use of technology and the internet. So we have a lot that's coming, and we feel that this is a division-wide and a region-wide strategy to fight this disease. And it is a team sport, and together we can fight this disease. So please join us in our fight against brain attacks.
Beautiful. Well, Dr. Vallabh Janardhan, it has been an absolute pleasure having you on the show. Amazing information you shared, and I think this is so apropos we're discussing because, as we all know, the National Institute of Health has declared this the decade of the brain, so you're one of the leading specialists in this area, and it's been an honor having you.
Thank you so much for having me and the opportunity to be here. And we really need to get the word out to our community so that people can recognize strokes quickly and come to the hospital, and also understand that there are cutting-edge therapies that can provide hope. We are still not there completely, but we have a long way to go, but we are much better than where we were.
And please give the website for the Texas Stroke Institute for our viewers.
There's a lot of good information. This is Stroke Awareness Month, and there's a lot of good information on our website, TexasStrokeInstitute.com.
Beautiful.
And there's a lot of videos, animations, and a lot of good information about what brain attacks are. And so I urge you all to be able to view that website and gain more understanding of this disease.
Beautiful. Thank you, Doctor.
Thank you so much.
Folks, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll be back in a moment.
The Texas Stroke Institute is dedicated to compassionate, multidisciplinary, and quality care for patients who suffer stroke and disorders of the head, neck, brain, and spine. Physicians at TSI offer patients cutting-edge treatment options for neurovascular disorders, including minimally invasive catheter-based therapies for adults and children. TSI encourages academic and research excellence, community awareness, and prevention education. The Texas Stroke Institute is a collaborative initiative that includes 11 North Texas HCA hospitals. The goal of TSI is to develop an effective and resource-efficient plan to reduce the morbidity, mortality, and economic burden of stroke in the region by incorporating medical education and participating in research. Texas Stroke Institute physicians practice multidisciplinary medicine to drive best practice in patient care. Their vision is to become the first system in the North Texas region to offer multi-facility comprehensive stroke care. Texas Stroke Institute, Dallas, and Plano. For more information, visit TexasStrokeInstitute.com.